Mike Steger here with Westside-Medical. Today we're going to talk about how you can fix your elbow pain using just a lacrosse ball. We're going to talk about lateral epicondylitis. It's a big fancy word for when these extensor muscles here get really tight. Their insertion point, or where they originate right here, the lateral epicondyle, it causes little microtraumas that causes pain and inflammation. Now, a synonym of this is called tennis elbow because the action here of extending that wrist, which you see in tennis, also causes that pain. But you don't only see it in tennis players, you see it in anybody. Anybody uses like any kind of grip, to work their, to like a manual labor or for exercising. You see it in weightlifters a lot. Even when you bench press, and you squeeze that bar and you press all these muscles here where they originate, the lateral epicondyle, that causes that pain. And so what happens is like the pathology of it is like these muscles, the extensor muscles, when they get overused, they become really tight and fibrous. And when they insert here in the lateral epicondyle, you get little micro tears. And so that's actually tearing out of like the lateral epicondyle or like the humerus of that arm bone, and it causes inflammation and some scarring and adhesions there. When you see somebody that has like a band that wraps around here, that's like a common treatment for lateral epicondylitis or tennis elbow because it compresses and it takes the tension off of the extensor muscles. But today we're going to talk about what you can do to help fix it. So what we do is we use a lacrosse ball here, and we're going to do something of what we call compress and traction. And so you can do it on the floor on the wall. You're going to take the lacrosse ball and you're going to work the entire muscle belly of the extensors here. So you're going to compress it, so you're going to push in, and then you're going to traction it. You're going to bring that muscle through its range of motion. So this is the shortened position of it. Compress it, and you're going to flex that wrist so it's pulling those muscles apart there, pulling those adhesions. And so you compress it, and you pull it through, and it's breaking up those adhesions, and it's taking all the stress of the origination right here of the lateral epicondyle, and when it starts to take all that pulling off there, you start to ease up on those little micro tears, and it allows for healing. Another technique we like to use is called cross friction. So you take the ball like right through here, and it's going to kind of work back and forth and rotate that arm like this, and that cross friction is going perpendicular to the muscle belly there, breaking up the adhesion. So what you do is you work the whole extensor region through here, and then you also can focus right on the lateral epicondyle here. So you can do cross friction on that lateral epicondyle, as well as find where it's tender, and you compress it, and you're going to pull those muscles through there. So you compress and traction. So you you extend the wrist, compress, and then you're going to traction it through. I also like to work the lateral head of the tricep when we do this. Like it doesn't have actual insertions onto the lateral epicondyle, but the proximity of it, like the fascial attachments, it's good to work that also. So how you work the lateral head of the tricep is the same concept. You can do cross friction, where you compress it and you go perpendicular to the muscle, break up those adhesions, or you can press and traction. So you shorten the muscle, you compress it, and then you're going to pull that muscle through its range of motion. And once again, it's pulling apart those adhesions there. So when you pull apart all those adhesions, you relax these muscles, it takes the tension off where it inserts there. So when the tension's off there, it stops those micro tears, which is causing the inflammation and pain. So we'll demonstrate here. So lacrosse ball, I like to use a wall. So you're going to push your weight into it, right in the extensor, and then you're going to pull that muscle through. So compress and pull. Compress and traction it. Compress, pull. So you're going to work that entire extensor region. So that's the compression and traction. And then you're going to find that band or where it's tender, and you're going to do cross friction. So you're going to kind of just work right against it. You can actually see the muscle flick. I don't know if you can see that where it bounces back and forth, because I have some tension through mine. So that cross friction helps break up adhesions. And then you work the muscle belt, and you work up to where the pain is itself, the lateral epicondyle. You're going to do cross friction on it, as well as you're going to compress it and traction out those extensor muscles. Good. The next step, talked about the tricep here. You're going to compress it and do cross friction on that lateral head, as well as you're going to compress and traction. So you're going to compress the tricep there, compress it, and you're going to pull it to that range of motion, like that. Good. So this lacrosse ball is something really nice you can have. Just keep it in your gym bag. I do this probably about 3 times a week. Hope that helps you guys. Visit us at Westside-Medical.com.